want to recognize October 24th, October 30th as Respiratory Care Week. And this is a week that's been designated National Respiratory Care Week by the American Association for Respiratory Care. And we are joining in that recognition here. We have the American River College Respiratory Care Program, as some of you may be aware, and includes graduate respiratory care practitioners among others. Of course, with respiratory care, people are in that practice are focused on chronic obstructive pulmonary disease, which includes a number of things, but in particular such things as asthma and even tuberculosis, which of course present important public health concerns. This is especially also meaningful to me as a past president of the local chapter of the American Lung Association, once upon a time, and a state board member of that organization. I remember, as I think probably many of us do, if you think back to at least the late 70s when I came to Sacramento, there were really very few people that you knew who had asthma. You might not even known anyone who had asthma. Today, I suspect if we asked each of us, we can name very quickly any number of people we know who have asthma, which is an indication of what's happened in our own region, particularly with respect to air quality and other factors that are predicates of asthma and other respiratory-related diseases. So it's important, I think, not only that we recognize the great work that's going on by those surrounding me and their colleagues, but it's also important to try to raise public awareness and consciousness through recognizing this week, so that people are thinking about and doing as much as possible to limit respiratory disease and to assist those who cope with it. And of course, it's our youngest and our oldest that are the most vulnerable to respiratory disease. So they are special populations that we have naturally care even more deeply about. So on behalf of the board, allow me to present this resolution to all of you, representing the community, and with our thanks for the work that you're all doing in respiratory care, and with our best wishes for a wonderful week celebrating Respiratory Care Week with really the true hope that what we do is see a steady decline in respiratory disease over the coming years and decades. So, would like to accept this. Okay, great. Thank you very much. And you're welcome to say something and introduce the group.
Thank you. It is an honor as well as a privilege to stand before you and also to acknowledge this award. Respiratory care is one of the many programs we have at American River College that is perhaps not as well known as nursing, but is equally as vital and rewarding a career. And as Chairman Dickinson just mentioned, we work primarily with people who have respiratory diseases, as well as those who suffer from cardiopulmonary issues as well. We work in a variety of hospitals as well as subacute settings, and we're just very proud and honored to be a part of this ceremony and also to continue the tireless work that needs to be done in order to eradicate respiratory disease and then mitigate the suffering and the pain that comes from COPD, which is chronic obstructive pulmonary disease. Thank you very much for having us this morning.
Could you introduce who's with you?
And I'm Dr. Stephen Boyd, and I'm Dean of Health and Education, and we have also faculty members that I think deserve introduction as well. John Coldarn with the Respiratory Care Program, Lisa Bedulia, and also Alan Gonzalez. And we're very proud to have all of them here. And as our faculty, they do a wonderful job. And we have the senior class, some of the members of the senior class that are able to meet with us as well. they will be graduating in December. So I really appreciate them being here, and many of them are coming off night shifts as well as we work in hospitals. So thank you guys. In the program, total approximately 60 students. It's an Associate of Science program. They graduate with an Associate of Science degree, and it takes 2 years on the books, but really more like 3. And when they graduate, they sit for board exams, and they pass at 100% rate. National standardized board examinations, and they enter the workforce rather quickly. And we've been in existence for approximately 38 years, and we proudly say we built the city, and it's because of the ongoing commitments of the college, as well as dedicated professionals and hospital affiliates that allow us to continue the great work that we do. Thank you very much.